you, Delhi Orthopaedic Association, for giving the opportunity. As you mentioned, I am an engineer. I am a biomedical engineer. I'm not a surgeon, but I've had an opportunity to work in this field for almost 18 years. So hopefully, I'll be able to give some insights. Let me just share my slides. Okay. Um, my talk is on scope of 3D printing post-COVID era. What we decided to do is we want to share our experience. We are a 3D printing supporting orthopedics, and last 6 months we have had an opportunity to actually support orthopedic surgeons across India, especially during the COVID times, and how we were able to do that. So what we have done is we picked the three examples that will kind of share we want to share and talk about. So these are three different areas that we want to talk about. One is a 3D model and how a 3D model was created for an acetabular fracture. Another is that one was in Chennai. The other one was on the surgical guides and how for reverse shoulder arthroplasty you can use these guides to accurately position your glenoid component. And the third one is on the customized implant, 3D printed implant. So hopefully this will give you an opportunity to kind of see how you can leverage some of these technologies and actually help you in your day-to-day, especially post-COVID era. So in the acetabular fracture example, the patient had during the COVID time, 84-year-old female. Surgeon was quarantined, so there was not much we could do. We were able to get a CT scan of the patient. We were able to create a 3D model of that patient. So once we had, this 3D model, like Dr. Bahuk said, image processing is still not there yet. So we had to, we use these FDA-approved software for segmentation and creating a 3D model. Once that 3D model was created, we shared that 3D model with the surgeon so that they can understand how exactly the fractures are, in what directions. The model was not enough. The virtual model was not enough. So we actually went ahead and printed a physical model, wherein we were able to send the surgeon that physical model so that he can plan the surgery. He can, place it. He can, use this model to create a pre-bent plate and things like that. Once that was done, and this was done all while he was sitting at home. One of the things we were able to leverage was to use local 3D printing services, so that we are not spending too much time on shipping and all. Especially, this is another thing we learned, that the whole local concept is going to work in the long run, because in fact, one of our partners in Mumbai were in quarantine region, so they could not even manufacture the part that we wanted to. So this kind of helped us change our plan, and we started now manufacturing these parts very near to the surgeon so that it can be delivered right away. Another example is on the glenoid axis guide, reverse shoulder arthroplasty, fractured scapula, 62-year female. Again, CT scan was done. We created a virtual model. So here's an example of a virtual model. You can see how the the glenoid surface is fairly shattered. We were able to plan the surgery virtually, look at everything, work with the surgeon to identify the exact axis in which we want to do the plan and execute it. For the execution, we were again, able to print it locally. This is a case in Delhi, so we printed locally in Delhi, provided this in one business day, and then using these autoclavable parts, the surgeon was able to place this, use this in the surgery to identify the location and kind of pinpoint the axis where exactly that axis could be. So here's a small video that kind of shows the positioning of the guide, and then drilling it right there. Okay, and then the third one, which is more on the customized implant side, especially with advent of 3D printing and metal 3D printing. Now we are able to actually print an implant that is customized for that patient. So here's another example. This was a case in Baroda in Gujarat, a failed fracture of a talus, male, 35 years old. Again, we started with a virtual model. What we did was, once we had the virtual model, we mirrored the other side, which was a good side, and then once that mirrored model was again 3D printed. In this case, also the surgeon was quarantined at home, so we were able to deliver these models and the different sizes of the implant, talus implant component that he wanted to look at. So we created about 6 different sizes, small, medium, large, extra large and extra small. And then he was able to plan even the ligament attachment and how we wanted to do. We continued to send him models, and then we would have a video call to kind of plan the surgery while he was at home. Once that was done, once he approved the design, we were able to manufacture this in a medical certified facility, a 3D printed titanium implant for talus. So here's an example of how that titanium implant was being manufactured here. So these are the these are the models. We ended up having 3 different sizes, so that intraoperatively the surgeon has an option of choosing which size he wants to use. And then yeah, those were post process made ready for the surgery. And these are some pictures kind of in the surgery to show you. We had a trial component, we had the final implant. These are some ligament attachments that he used. And yeah, so this is the post-op video that kind of shows how this is. What is fascinating for us is our ability to mirror the good side of the ankle, and you can see the contours here, and it's fascinating that the contours really match well with the patient. And this is hopefully what helps with in terms of having a patient specific implants and allowing to have a better outcomes in the long run. How does this work as a process? So just a quick overview of the way it works is typically a CT scans are taken. It needs to be 1 millimeter slice. I think that's the most important piece. Is as long as you have a 1 millimeter slice thickness CT scans, we are able to take that in and provide the 3D models. Those get uploaded to platforms like mysegmentor.com, wherein this data gets received, post-processed, visualized, and then you can see the entire traceability of printing as well as delivered autoclavable parts in the surgery. These are some examples of now the advanced these platforms allow surgeon communication as well. Before you used to have these physical models and kind of mark that and talk to the engineers. With these kind of digital platforms, it allows us to also kind of communicate with surgeons on what exactly they are looking for, so that while they are at home, we are able to have these communication details that help us kind of move forward and get their feedback whenever they are free. Not especially in these COVID times, it becomes very difficult to get their physical time and actually meeting them physically. So we have moved more towards a digital platform wherein we can communicate through these platforms. This is kind of the network or how things work. The surgeon and the hospital staff uploads the CT scans. The surgeons is able to look at the 3D model on their phone or on their computer. Of course, they are also able to use the guides and the models or even an implant in the surgery. The patients, the link is open, so the patients, we were able to incorporate like a payment portal, so that the patient is actually making the payment through the same portal. And then the 3D printing service bureaus who are locally there near the surgeon is able to print it quickly and then deliver it as soon as they can. So in conclusion, the 3D printing technologies are here to stay, especially with COVID era, especially when you have complex surgeries, and it actually does help surgeons plan and execute with confidence, especially whether it's anatomical models, surgical guides, or customized implants. With that, I want to thank you, and over to you, Dr. Pankaj.